While we are discussing the disorders of the childhood and the adolescent age group, first of all, defining these age groups is again very important over here. Children under 5 are usually reported to the clinicians or the psychiatrists, and usually the parents are worried about their abnormal behavior, their under average or below average intellect. These are the usual causes that the parents are worried about, and the psychiatrist is usually consulted due to these problems. So the adolescent age group is basically the age group of the teenage over here, and they have their specific problems. So that is the crux of this lecture that we'll be discussing over here, the adolescent age group, and along with that, the childhood is again sometimes very problematic, and we should know how to distinguish a normal child from an abnormal behavioral or an intellectual child. So these are the disabilities that we'll be discussing over here. How do we basically go about identifying these characteristics in general? What are the clinical symptoms and signs that we should observe in a child to distinguish him or her behavior as a normal behavior or whether it is an abnormal behavior? So these are the terminologies that we'll be discussing or we'll be clarifying in detail over here. The mental health disorders, they basically encompass that are related to specifically this age group. They encompass usually the feeding problems, the weaning problems. Then there are a lot of intellectual problems in which the IQ can be calculated, but sometimes calculating the IQ in the children under 5 is quite problematic. So you should know the sign and symptoms to the particular disorders that we'll be discussing subsequently in this lecture. So the adolescent age group, we can obviously calculate the IQ over here and just know whether the IQ is of age related or not. And then again, the behaviors are also very important. Sometimes the IQ is normal or even it's above average, but the behaviors are not quite normal. So even these conditions, clinicians should know how to distinguish even these conditions that can be referred to as ADHD, that is the attention deficit hyperactivity syndrome. Then there are a lot of autistic children that have above average IQs. So all of these conditions, clinicians should know how to distinguish between these different clinical presentations and clinical syndromes, of course. So over here, we'll be specifically, first of all, focusing on the definition of an abnormal disorder, a mental disorder in which the child or the adolescent kid is basically suffering from some sort of a psychiatric illness. And then the causes that are related to such mental health disorders, they'll be discussed over here. Obviously, we'll be dividing these causes into the genetic causes, then the environmental factors, then the factors related to the family of that child is again very important. The factors that are important to consider while you're treating these children is again very important, and we'll basically be discussing them as well in this section. First of all, the introduction. Child and adolescent mental health is the capacity to achieve and maintain the optimum psychological functioning and well-being, directly related to the level reached and competency achieved in the psychological and social functioning. So this is how do we go about and define and what are basically the expectations when you are treating or when you are looking at a child and an adolescent age group kid, and you just want to know whether he is going to be categorized in a normal and or whether it is an abnormal behavior that is observed in that particular kid that we're talking about. The classification that we usually refer to in children under 5 and what are the disorders that are commonly seen in children under 5 is the oppositional defiant disorder. And then we have the conduct disorder that are obviously related to the normal day-to-day behavior of the individual. And sometimes the parents would come up to you and they would basically complain that the child's behavior is improper. He has temper tantrums. So having temper tantrums at the age of 3 is quite normal, but having temper tantrums at the age of 10 is quite abnormal. So basically, the conduct or the behavior of the child should be age related. So the neurodevelopmental disorders, they include the autism, which is also known as the autistic spectrum disorder, and then we have the attention deficit hyperactivity syndromes. Then we have the emotional disorders. We have basically the eating disorders, which are quite similar to the ones that are observed in the adult age group. For example, the bulimia, and then we have the anorexia nervosa in a lot of kids. And then the substance misuse is sometimes observed in the adolescent age group, and that we should also keep in mind over here. So the aspects to consider when we are considering these problems are sometimes age related. The behavior should be age appropriate. Temper tantrums at 10 years, they are not appropriate. This is basically not an appropriate age group for having the temper tantrums. Then the frequency again is very important. The frequency of that particular behavior. To get depressed once in a while, it's normal, but to be in that depressive stage for longer periods of time and having repetitive episodes for that depression, the behavior is then considered to be abnormal. So something happening more frequently, for example, if a child is going through panic attacks more frequently. So if he's having panic attack once in a while due to some relevant cause, then having panic attack is to be a normal behavior that is observed in a child. But having panic attacks quite frequently, which are basically hindering the daily life activities of that child and basically without any reason, so that is considered to be an abnormal behavior which can be observed in the child. Then the severity, the milder forms are not a problem, and severe forms that hinder the daily life are the particular problems that we should be dealing with. The temperament of the child is one of the aspects that we should consider when we are dealing with such patients. A particular event can be handled by one child and it is not handled by another. So it is something that is variant from one child to the other. So it can be considered to be a normal thing which is found in some of the children. Then the impact on the others. If the behavior is too aggressive or the child is too much in a depressive mode that it is basically hindering his or her daily life, then it is considered to be a problem, and then it is going to be treated in a specific way. Family circumstances are going to be considered. For example, if there is a parental depression or if there is a parental separation, all of these factors have to be considered. Unemployment of the parents can be one of the causes over here. So these are some of the causes that one should consider when one is taking the history from the parent, or one is taking the collateral history. All of these factors, what is the familial environment, what is the general environment at home that the child is facing, then what is the impact of his behavior or her behavior on the others while he's in the school or while he or she is at home. So all of these factors have to be considered while you're taking the history. Sleep problems are quite commonly observed in children under 5, and then we have the feeding problems that are observed in these children. Sometimes it is just a normal fadding process. Fadding is basically defined as when the kid doesn't like the texture or taste of the food. Then the behavioral problems are sometimes observed. Sometimes it's quite an aggressive behavior. Sometimes it is an unsocial behavior that is observed in the kid. Oppositional defiance disorders are again quite of an aggressive type. The conduct disorders in which the child has a particular behavior which is not considered to be normal of his age. So these are basically the problems that are considered as the mental health disorders that the child or the kids that are belonging to the adolescent age group, they go through. So that is the end of this section. Thank you for watching sqadia.com.